This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Like many teenagers, Pauline Ganzon has an active lifestyle. But unlike other young girls her age, Pauline has diabetes.
Actually, malakas kasi ako kumain. Then suddenly, yung weight ko, weight loss bigla. Talaga mahilig ako sa sweets ng bata pa.
Pauline was diagnosed with type 2 diabetes when she was 11.
If it's diabetes type 2, it's more on insulin resistance. So this involves your diet, if you have a sedentary lifestyle.
Kapag lumalabas kami gano'n, yung mga gamot ko kasi kailangan on time, gano'n. Parang iniisip ko, ano ba yan? Parang kailangan ko na umuwi, pero nag-i-enjoy pa ako.
Diabetes is a metabolic disease in which a person has high blood sugar. This happens when the pancreas does not produce enough insulin, or when cells do not respond to the insulin that is produced.
There are several risk factors, and one is if you eat a lot of the sweets or syempre sugar.
Pauline's sugar level shoots up to 300 to 400 milligrams per deciliter as compared to the normal rate of 90 to 110. To regulate her blood sugar, Pauline takes insulin.
Nung nag-high school ako, syempre, pasaway. Kain akong ano-ano. Binalik yung insulin ko. So, until now, meron na.
Pauline also has to be careful with what she eats because too much sugar in her body can lead to fatal consequences.
Kailangan talaga ng discipline kasi kung wala kang disiplina, magkakaroon ng complications.
Diabetes is actually a worldwide problem. It's very, very prevalent. As of right now, around 2010, there are around 200 million individuals who are diabetic worldwide. So this number is actually, they say that this number would double in 2030. So we need to address diabetes right now.
What are the different types of diabetes? Who are more prone to have this disease? How should one properly manage diabetes? All these and more tonight on MedTalk.
And joining us tonight is Dr. Macy Son, endocrinologist from the Makati Medical Center. Also with us is Dr. Mia Fojas, endocrinologist from the Medical Center, Manila. Good evening, doctors. Welcome to the show.
Good evening.
In general, we keep hearing of people suffering from diabetes. We hear the words insulin, we hear the words high sugar, low sugar, injections. What exactly is diabetes and how does it affect one's health and general well-being?
Diabetes is actually a disease of metabolism. That is the way the body uses the food for energy and for growth. So when food is taken in our body, it is broken down into sugar or glucose. This glucose should be taken up by the cells for it to be turned into fuel. And in order for the cell to be able for the cell to do this, it has to have a hormone called insulin. Insulin is like a key that opens the cells. So if you don't have enough insulin, or if your insulin is not working, you might develop diabetes because of the high blood sugar in the circulation.
So insulin is a hormone?
Yes,
it is.
Okay. And how does one, when this hormone is not functioning well, what happens to the individual?
Oh, well, your sugar accumulates in the bloodstream, and of course, if it's in the bloodstream, it goes to the different tissues in the body. So if it's so high, then it can accumulate in the eyes. You can have your retinopathy, okay? You can have early cataract formation. If it's in the
kidneys, no, your kidneys ordinarily would filter out the sugar. So ordinarily when you pee, your urine comes out without the sugar. So if it accumulates and it goes through the kidneys often, so it can damage your kidneys. You can have nephropathy or kidney disease due to diabetes. Also, you can have complications in the heart. You can have cardiovascular disease, atherosclerosis. You are at a high risk for developing cardiovascular disease once you're diabetic.
Okay, so these are the complications already that lead
Also, it can damage your nerves as well.
Yeah.
Wow. So these are the complications.
Yes,
you
the
mentioned,
complications
of one having diabetes. What's the very basics of diabetes? How does one is one predisposed to it? Is it genetic? Is it environment? Is it the lifestyle? Is it the food we take?
Diabetes actually consists of two things. It could be inherited, but you don't inherit the disease. No? You inherit only the predisposition to develop the disease. And in order for you to develop diabetes, the environment should trigger it. No? So the genes don't act alone. No? It has to be with the environmental trigger.
And what are the environmental triggers?
So,
of course, a sedentary lifestyle. Of course, as children and as Filipinos, we are also at a high risk for developing diabetes. Asians in general.
Why is that?
Well, maybe it's the race and it's probably culture. As children, oftentimes we're happy that our children are fat because they look healthier. But then again, later on, they can get predisposed to diabetes if they continue with their lifestyle, like high carbohydrates and high fat intake. And right now, all of our children are exposed to the fast food.
Yes.
Okay? And currently, there are studies that are saying that red meats, eating red meats can make you prone to develop diabetes also. So
That's a new study, no?
Yeah.
Why is that? Maybe we can talk about it a little bit.
Yeah, well, you become more insulin resistant. No? Instead of using up your glucose for energy, your metabolic fuel comes from the free fatty acids, which is the wrong kind of fuel source in the body. So that's wrong. Those things, you become insulin resistant, and later on you develop type 2 diabetes.
Okay, we've mentioned that there are different types. You mentioned type 2 diabetes.
Yeah.
Let's talk about the types of diabetes and how is it detected.
well, actually, there are several types of diabetes, but there are three more common types of diabetes. The first one, the most common, is the type 2 diabetes, which is the one that wherein the person does have enough insulin or maybe more than enough insulin, but because of some reasons, the body is not responding to the insulin. So that's why the patient also develops high blood sugar and type 2 diabetes. So initially, this kind of diabetes can be easily managed by taking out the risk factors, like she said, being overweight, being immobile, and those are but later on, when the pancreas is already exhausted, there'll become a time that they also need medication. Usually they start with oral medication, and later on only when they will need insulin if they are really uncontrolled.
Okay, so type 2 diabetes is the most common.
Common.
The most common type of diabetes. How about type 1 diabetes? Please describe to us this type.
Type 1 diabetes, formerly known as juvenile diabetes or insulin-dependent diabetes, although we don't use that term anymore. It's really type 1 diabetes. Usually these are diagnosed among children.
Like our case study earlier.
No, but she's type 2 diabetic.
Already.
So
Okay.
type 1, you really diagnose that really early, at even less than 10 years old or 5 or early. They become, the sugar goes up, and then the parents would notice that their children is not gaining weight. They keep on peeing a lot. As babies, they cry a lot, and then they go to the emergency room, and then they diagnose the children with type 1 diabetes because of the high blood glucose. And they are required to have insulin shots already. Since childhood. So they are required to have insulin shots until adulthood forever. It's a maintenance thing.
Oh, wow.
And currently, they're still researching on the treatment for that.
For type 1
For
diabetes.
type 1.
And then the last one is
Gestational
diabetes.
A little bit about that as well.
Okay. Gestational diabetes is diagnosing high blood glucose among those who are pregnant. There's also pre-gestational diabetic, wherein the patient has been already diagnosed with type 2 diabetes before type 1 or type 2 diabetes before getting pregnant. However, there are different ways of diagnosing gestational diabetes where if the patient is at high risk of developing diabetes, you do the 75-gram oral glucose tolerance test, and there are certain cutoffs for that. So it's a different cutoff for gestational diabetes versus those who are being diagnosed with type 2 or type 1 diabetes.
So we go back to the type 2 diabetes. You talked a little bit about type 1 and gestational. Let's talk more about the more common type of diabetes, which is type 2 diabetes.
Yes.
Is there any physical manifestation of someone who has
usually the type 2 diabetic is said because of the predisposing factor. They're usually overweight, no? And they usually they couch potatoes usually, and there's also some people who have type 1 personality, overstressed, no? They tend to develop diabetes. And as I said, there are certain ethnicities, no? Where type 2 diabetes is more common, like Asians are African Americans. We have Mexican Americans, and also the what they call the Pacific Islanders. They are prone to diabetes.
So, also, there are 3 Ps, polyuria, polydipsia, polyphagia.
What are these?
Polyuria is you keep on urinating. So they wake up in the middle of the night, they pee multiple times. So some of them are unable to sleep. Polydipsia is drinking lots of water. They feel thirsty all the time. So they have to replenish every time they pee, they drink water. But sometimes people just don't drink water because they don't want to wake up to pee, okay? And then there's polyphagia. They get hungry often. So they get to eat a lot. So sometimes you cannot blame these people because sometimes you look at them and then they drink like sodas, no? So sasabihin nila, they tell us, siya kasi, she keeps on drinking soda. That's why she's diabetic. But as a matter of fact, not really. But if you have poor sugar control, the body does not really detect that your tissues don't have enough blood glucose for energy. That's why you keep on looking for sugar. So that's why they search for cold, sugary drinks. Just so they have that to replenish energy. But then later on they get to be that too, and they get to be thirsty. So it's a vicious cycle.
Is having type 2 diabetes a lifelong
Yes,
disease?
once you're diagnosed diabetes, you will be diabetic forever, but it can be controlled. No? You can live normally, no? Like any other person, as long as you do the right things, and if you take your medications if needed. No?
Okay, so if needed, so is there someone who has been diagnosed with type 2 diabetes who does not need medication, who can just change their lifestyle? And
as long as the patient is compliant. No? So actually the best treatment for type 2 diabetes is still lifestyle. Diet and exercise. In fact, it has been found out really that the best treatment for diabetes is exercise.
No? Best treatment for diabetes is exercise.
Yes, aside from the diet, is exercise. Is more. It's better than all the medicines combined. If you are compliant to exercise, then most probably you will be able to control your diabetes.
Okay, so one sign or one physical manifestation we mentioned is being obese. What are and urinating a lot and searching or looking for cold, sugary drinks all the time. Are there other
blurring
signs
of vision
or symptoms?
Yeah.
Sorry.
If you have diabetes, you have blurring of vision.
Are you also
or
blurring
easy,
vision?
and then you're easily fatigued, no, because of lack of energy, and sometimes you have in cases which are already far gone, you have delayed wound healing, no.
Oh, okay, so these are also the signs and symptoms
for
of
the
one who has type
women,
2.
you know, they'd consult us because they just came from the OB-GYN. So they go to the gynecologist because of the frequent vaginal pruritus or itchiness down there. So later on they get diagnosed to have type 2 diabetes because of that. No? Also frequent urinary tract infections. That's how we get some of them. The others would have
tuberculosis.
Tuberculosis. They come from the pulmonologist, and then of course the pulmonologist, one of the risk factors for developing tuberculosis is poorly controlled blood glucose. So there.
So now we've talked about understanding diabetes. When we come back, we'll talk more about managing, controlling diabetes, as well as answering our Facebook and Twitter questions when MedTalk returns.
Did you know that an Olympic gold medalist is a type 1 diabetic? His name is Sir Stephen Redgrave, who has been suffering from diabetes since 1997. Despite having this condition, he continued training hard and won his 5th Olympic gold for rowing in Sydney in 2000.
We're back here on MedTalk, still talking about managing, controlling, and understanding diabetes. When we cut to the break, we were talking about type 2 diabetes, and now we're going to answer our Facebook and Twitter questions. Our first question from Facebook: is it true that if your urine attracts ants, this could be a sign that you are diabetic?
As I mentioned earlier, right, some patients would pass out sugar in their urine. So that's one of the, and then that would lead to complications. We have a slogan, we had a slogan before that, it's mabuti pa ang langgam alam, no? So ordinarily, you don't really have to pass out glucose through your urine. So ants would look for sources of glucose. If the ant is there, definitely you have sugar in your urine, and that might be a sign that you have diabetes. Okay, so if your glucose reaches mga 180 milligram per deciliter, that's a time when you pass out glucose. So you don't really know how high your glucose has been.
So it's always good to check.
Yeah.
Always good to check, no? Okay. Next question from Facebook: is it true that people who are obese are more likely to have diabetes? We were talking about this earlier.
Yes, definitely, no? Because as we were saying, obesity is one of the risk factor for diabetes, because if you are obese or overweight, you tend to have what we call insulin resistance. That means you have a lot of insulin, but your insulin is not functioning well, and because of that, the cells are unable to take up the glucose. So the glucose accumulates in the blood. Yes, so that's why it is imperative that when one is obese, especially if there's a family history of diabetes, you should lose weight, no, right away. Any weight loss, even 5 to 7% weight loss, will prevent you from having diabetes.
Okay, we'll go back to our Facebook and Twitter questions. Now we go back to, we were talking about this earlier, insulin. So what is insulin again, and how does it work?
Okay, Dr. already said that insulin is like a key. It's a key wherein it has a receptor in your cells, no? So there's you have your liver, you have your muscles, and you have your fats, no? Your muscles especially need insulin so that glucose can get into your tissues as fuel for energy later on. Without insulin to these tissues, you will not be able to utilize glucose. So insulin is like a key so that glucose can enter your cells. So what does it do? Aside from making your glucose enter the cells, it will help turn these glucose into energy, and then later on, no, yung mga our type 2 diabetics who lost a lot of weight, that could be that could help them gain a little more weight. Insulin is an anabolic hormone. It makes your tissues grow properly, and it also is an anti-inflammatory agent. That's why sometimes when you have wounds, no, it will help your diabetic wounds heal faster.
Okay. And then we hear of insulin shots. So when is an insulin shot given, and how does it work in the body?
Well, insulin shot is usually given to those patients, type 2, if type 2 diabetics, when they are uncontrolled, no, with diet and exercise or with the oral medications. So we usually give shot. But sometimes if the, what we call, we have a value, we have such a thing as an HbA1c, that is the percentage of the glucose that is attached to our hemoglobin. If it's already a level of 9%, we can already inject insulin. In fact, they said early insulinization is useful because it makes the patient prevent complication better.
Added to that, no, some doctors would really start patients on insulin early because it will help your pancreatic islet cells, where your insulin comes from, where your own insulin comes from. It will help your cells heal faster, so that, because when you're diabetic, no, you have exhausted your pancreas to release a lot of these insulins. Yes. Now, they get tired. That's why we make them rest, giving exogenously insulin shots. So it doesn't mean that if your patient is on insulin now, they will be on insulin for life. You just make the pancreas rest with it. Okay. And then later on, you can maintain them on oral anti-hyperglycemic agents.
So it doesn't necessarily mean that you'll be on it for life.
Yes.
No, okay. Especially nowadays. No? Before, during the old times, no? When you use the insulin at the end, no? It is the last resort. That's the time that you will be on insulin forever, because there are no more insulin-producing cells in the pancreas. But when, as I said, if you do it early, in fact, there are now studies, no? Showing that you can give it upon diagnosis, or even there is a study that has been done that gives insulin to those who are only at risk for diabetes, as long as it's abnormal, because it is like preventing the exhaustion of the pancreas.
So only at risk, meaning you have not been
that's what we call before
yet.
The pre-diabetic. No? So that's what we call now high risk for diabetes. So there's a study, but it's not really commonly used yet. No? There's still a study. It's been going on. We have been reading about that study, and maybe it will catch up later on and see if it will be a common method of doing. Not yet.
Not yet. But how about those who are diabetic? Do all diabetic patients need insulin shots?
No.
Not really, because as we said, there's still lifestyle modification. A lot of them can be maintained on very, very low doses of oral anti-hyperglycemics. And right now there are
hyperglycemia.
Your oral medications for high glucose. Hyperglycemia is high glucose. So you can give them low doses of these medications, oral medications, and they will still be controlled. So not necessarily, you don't really have to give them all insulin. Some of these patients are really good, and they follow.
They should follow.
Some of them are good patients.
Well, now we have really a lot of classes of medicines, no, to choose from to treat type 2 diabetes. Unlike before, then wherein we have only 2 or 3 classes of medicine, now we have 12 classes of medication. So we have a wide array. But the main goal really of the treatment of diabetes is to save, no, to save the remaining, no, islet cells of the pancreas. And there are now medicines that can do that. No? That can save the islets of the pancreas, oral medications that are in the market that can save the pancreas. And we really hope that that later on, no, we will be able to do that, no? That we will prevent more complications, no, of diabetes.
You mentioned preventing diabetes. How do we go about doing this? How do we educate our viewers and everyone out there how to prevent diabetes?
As you mentioned, it's education.
Yes.
We really have to educate a lot of our fellow men, especially here in the Philippines. We have to tell them what good lifestyle is. Well, start from the children. Okay, so in schools, right? So we have to tell them how important vegetables are. Okay, how important it is to stay away from all these high-fat meals, fast foods, right? And then maybe educate the fast food chains as to how they can make their foods healthier, and also encourage exercise. So that's very important. Exercise and weight loss. It's very difficult among children right now because we have a lot of these gadgets, and most of them would just play in front of the computers instead of exercising, right? So that's one of the ways. So lifestyle modification is a very important thing. We cannot really help our genes, but you know, these genes are just triggered by environmental factors. So that's very important.
We can go back to that a little bit later on, Doctor. Thank you. We have a Facebook question. I take insulin shots because I'm type 2 diabetic. Now that I'm pregnant, can insulin bring any harm to my baby? What should I do?
Well, actually, insulin is the best treatment, no, for diabetes when you are pregnant, no? And it is safe for the baby. You just have to monitor it very well. No? You should be ready to do glucose monitoring, and in order to be successful, you should attain all the normal values for diabetic. No? So it's a
type of diet that
well,
pregnant woman should do.
It's the same as an ordinary type 2 diabetic. You should really stay away from sugar, count your carbohydrates and fats. Remember, fats can also increase your blood glucose. When you have been diagnosed with gestational diabetes, you have to monitor your blood glucose more often, because if your glucose goes up, especially after a meal, that's a time when it harms the baby. It's not just simply fasting blood glucose. No, it's your postprandials, or your 2 hours after your meal. No, so you have to monitor at first 7 times a day: pre, post breakfast, post lunch, and at bedtime. So that's 7 times a day. You really have to watch out for it. We're stricter when we have gestational diabetics, especially on insulin. The targets are really low.
But it can be controlled, and it won't harm the baby as long as you...
It should be controlled, actually. It should be controlled.
Right. And we have a question from Facebook. I can't live without drinking coffee. What are the best natural sweeteners that I can use for my favorite hot drink? Natural sweeteners.
Okay, natural sweeteners. So far, I can only think of a natural sweetener such as stevia. It's very bad to advertise, but it's one of those things.
Stevia is a plant.
Stevia is a plant, but it's been chemically developed. Yeah, so it's stevia. Splenda is also okay. No, all of these artificial sweeteners have been actually studied. So the risk for cancers have been discussed, and these are anecdotal evidences. So we won't really come out with these sweeteners unless they have been known to cause these cancers. But everything should be taken in moderation. Also, we have to stress out that honey is still sugar. It might be natural, but it will increase your blood glucose as well. So does muscovado. Okay, cocoa sugar has low glycemic index, but you tend to add more.
Still sugar.
Yeah, it's still sugar. You tend to add more because it's not that sweet. So that's it.
Okay. It has lots of calories, and it could be fattening.
Okay. So on that note, general conclusion for tonight's episode on managing, understanding, and controlling diabetes?
I think what is important is that we know the risk factors for diabetes, and if you have diabetes in the family, as parents, maybe perhaps we should educate our children. And if we have diabetes, as much as possible, we should educate ourselves, because one of the most important, as I said, know your enemy so that you can combat it. And it is very important because of the many progress in the type of diabetes. It's not saying that you know all about diabetes at this point, because us also also. We study all the time because there's a lot of progress going on, and we should continue educating our patient.
Okay,
And as I said, you cannot fight diabetes without doing lifestyle, diet, and exercise. Medication will be used if needed, but those are not the most important treatment for diabetes.
Thank you, Dr. Sison. Dr. Fohas?
Type 2 diabetes is very, very preventable, and if detected early, maybe might be able to reverse it. Just do lifestyle modification, just consult your doctors, have yourselves checked. Don't be scared, because the earlier you get it, the easier it can be managed.
And it is treatable.
It is.
It is treatable.
With the current
and controlled.
medications, it's very easy.
Okay. Thank you once again, doctors. Again, I'd like to thank Dr. Sison and Dr. Fohas for joining us in our discussion tonight. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.